Welcome to Breaking Doctrine, presented to you by the Combined Arms Doctrine Directorate at the Combined Arms Center at Fort Leavenworth, Kansas. The views expressed here are those of the individual and do not represent the views of the Combined Arms Center, U.S. Army, or U.S. government.
Hello, I'm Major Chris Parker, and this podcast topic is Force Health Protection in the United States Army Medical Research Institute of Infectious Disease. With me today is Colonel E. Darrin Cox, Commander of USAMRIID. Sir, welcome to the show.
Thank you very much. Glad to be here with you.
So we're glad to have you because today we're discussing a different type of warfare, but one that's become particularly relevant given the events of the past year, and that's the Army's effort at combating infectious disease. Thanks to COVID-19, this subject has taken center stage, but the impact of infectious disease on warfare is nothing new. I'm struck by Walt Whitman's quote that this whole damn war business is about 999 parts diarrhea to 1 part glory. Whitman, who served as a nurse during the U.S. Civil War, recognized the reality that poor sanitation, large crowds, and austere conditions can quickly become breeding grounds for communicable disease. And history reveals that large armies conducting expeditionary operations are often both vehicles for the spread of disease and the victim of endemic or emerging diseases. As the world becomes ever more crowded and better connected, this trend is unlikely to change. The Army's recently published Biological Defense Strategy notes that biological threats and hazards will be pervasive features of the strategic environment for the foreseeable future, and the Army must maintain and increase its biological defense capabilities if it is to successfully prosecute multi-domain operations. So today, to help us better understand but one part of how the Army combats infectious disease is Colonel Cox. Sir, I'm glad you're here, and if we could just start with telling our listeners a little bit about yourself, your background, and how you wound up working at USAMRIID.
Sure. Well, good afternoon, and thank you for taking the time to speak not only with myself, but some of our outstanding personnel here at USAMRIID about our role in force health protection and multi-domain operations. By way of background, I'm a board-certified in both thoracic and general surgery. I've been in the Army almost 25 years and will soon be concluding my tenure here at USAMRIID. Now, when I first assumed command in July 2019, USAMRIID was facing some significant challenges. My initial charge was to restructure the organization and align core competencies and capacity with both requirements and resources so that we could best maximize our contributions to chem biodefense needs. And while my team and I tackled that task, not only 6 months later, our focus quickly expanded to include development of medical countermeasures to SARS-CoV-2 and our response to the COVID-19 pandemic. We were an early contributor to Operation Warp Speed and the whole government response to the pandemic while continuing our critical chem biodefense mission set.
Gotcha. So you guys have been quite busy. Unexpectedly so, I guess, would be a way of putting that. So now, for me, USAMRIID has a kind of a special place because as a kid, I remember watching the blockbuster 1995 Dustin Hoffman movie Outbreak. But aside from rising to fame there, our listeners may not know a lot about the USAMRIID itself. So I'd like to begin there, sir. Could you give us some background on the origins of USAMRIID, its development, and then its current actual mission?
Sure. So USAMRIID is in its 52nd year. It was founded in 1969 here at Fort Detrick, Maryland, and it's the DoD's lead laboratory for medical biologic defense research. We fall under the U.S. Army Medical Research and Development Command, also located here on Fort Detrick. USAMRIID is the largest biosafety level 3 and the only biosafety level 4 lab in the Department of Defense. Being a biosafety or BSL level 4 lab, what that means is that we're equipped to study highly hazardous pathogens, for example, the Ebola virus. These are the types of organisms for which you must wear those positive pressure encapsulating suits that you've probably seen in the movies or on television.
Yes, sir.
That look like spacesuits, because those diseases tend not to have any vaccine or any good treatments and are highly infectious. So USAMRIID investigates disease outbreaks, threats to public health, etc. We conduct our research in order to aid in the development of therapeutics or vaccines, diagnostics, or just research information that will both protect our military personnel and civilians. And although we're an Army lab, our research benefits all of the sister services as well as the general public.
Now, sir, you've already mentioned it, but USAMRIID plays a critical role in what's broadly termed or doctrinally termed force health protection, which are the measures to promote, improve, conserve, or restore the mental and physical well-being of soldiers. Now, this includes the medical surveillance and prevention activities typically associated with preventive medicine, which a lot of us in the operational force are familiar with. But your side of the house, the laboratory services, that's a whole other side to this. And so if you could you talk about how USAMRIID contributes to force health protection from the laboratory side?
Sure. So USAMRIID has multiple core competencies that contribute to force health protection. Some of those core competencies we've already discussed, such as biologic agent research. But then there's some areas specific to force health protection that are easily highlighted here. So, for example, in a broad area of force health protection that we would term surveillance and reachback, USAMRIID has the capability to rapidly identify biologic agents. We can do that both in the laboratory here, or we can develop assays that we can give to expeditionary units. For example, the 1st Area Medical Laboratory, the 1st AML, which is the Army's expeditionary field lab. We can develop areas of expertise in prevention, and that can be in our testing and evaluation of medical countermeasures. And when we say medical countermeasures, that's medications, vaccines, anything that helps us counteract those various organisms. We have a role in training and educating the force, so that's in both surveillance and treatment. We conduct the medical management of biologic casualties course. I've mentioned the 1st AML, but we also conduct a course called Field Identification of Biologic Warfare Agents course and the Outbreak Response course. And both of those courses are heavily subscribed not only by Army personnel but by sister service personnel as well as interagency personnel from other elements of the U.S. government. And then, in some areas that you're going to get into with, so I think some of the other folks on this podcast, but one of the things that is a key thing that is getting new highlight with respect to the results of the pandemic that we're currently in is preparing for uncertainty or preparing for that next threat. And we'll talk a little bit more about that, I think, in a little while. But, what that really means is that not only do we maintain that expertise, whether or not there's an ongoing pandemic, but we're always ready and we're always surveilling for that next incident that can, if not carefully controlled or detected, can potentially arise and become a major problem. And then one of our last core competencies would be simply maintaining the highest safety and security standards. Being the largest and most complex high biosafety level lab, we certainly produce a lot of personnel that have expertise in maintaining those safety standards, and a lot of USAMRIID alumni you can find elsewhere in the government or in private industry or in academia, and they're promulgating those safety standards that have been created and perfected over many years of practice here at USAMRIID.
Yes, sir. So and I'm curious about the biosafety level 4 thing. Now, so you guys are a biosafety level 4 lab, and is that on par with what like the CDC lab is in Atlanta? Is that the same tier?
So, yes, I mean, there's biosafety levels 1, 2, 3, and 4, and as I mentioned, we're the only DoD BSL-4.
Yes,
certainly
sir.
the CDC has a BSL-4 capability in Atlanta, and there are several other BSL-4 labs you can find throughout the country.
Gotcha. So now, when we look at biological threat agents, what you guys are studying in your lab, this includes both pathogens, such as viruses and bacteria, and then toxins. Just to give our listeners kind of a background, can you explain the difference between these agents? What are some of the ones that are studied at USAMRIID specifically?
Sure. So briefly, both bacteria and viruses are living organisms. Several examples of bacterial threats would be agents that cause anthrax, plague, and glanders. So these are diseases caused by biologic bacterial threats. And then viruses such as Ebola, hantavirus, Rift Valley fever, and others, some of the hemorrhagic viruses or the encephalitis viruses that we've heard about over the years, those viruses cause disease by entering the cell and replicating. Now, in contrast, toxins are not living organisms, but they're proteins that are produced by living organisms.
Okay.
So some examples of toxins would include ricin toxin, some of the staphylococcal toxins, and botulism. Botulism is an agent that is a toxin that causes disease.
Gotcha. I think if I remember back to like my high school science class, I think, isn't the botulinum, or is that what came to fame with I said poor canning practices, I guess? Is that
is
same?
Correct, yeah.
Gotcha.
You're correct.
So now when we look at all of these agents, these biological agents, are there certain properties that make some of these agents a greater threat than others from your perspective?
Well, yes. Our primary job at USAMRIID, as I mentioned, is to develop the medical countermeasures that protect against these agents. So, we're not experts on how to weaponize these agents. That said, however, there are certain physical properties like the stability of the organism that would make a potential biologic agent easier to use as a weapon. Another big consideration would be how easily it could potentially be made into an aerosol. Aerosolization means disease caused through the inhalation route, and the inhalation route is of grave concern from a battlefield perspective because an adversary could cause a great number of casualties at one time by delivering an aerosol over a wide area. And if you think back to some of the trench warfare in World War I, you can get an idea of what we're talking about, the ability to deliver an agent over a wide area. And that's why it's so critical to have medical countermeasures that protect against inhalational exposure.
Gotcha. So now in looking at all of these agents that USAMRIID works with and studies and the countermeasures that you develop, thankfully, most of them, or a lot of them, aren't common to the United States. Things like Ebola, Rift Valley fever, Lassa virus. So I assume that this requires a lot of multinational and interagency cooperation to stay abreast of the emerging diseases and their potential treatment. So, sir, can you give us some background on how and with whom does USAMRIID partner to tackle these challenges?
Sure. No, we rely on an extensive network of collaborators. I've mentioned some of them already, the other federal agencies, our sister services, academic labs throughout the United States and internationally, commercial companies, again, predominantly in the United States, but internationally, and then international partners that would include, some of these academic labs and commercial companies, but also our international, our sister services in our NATO allies predominantly, as well as elsewhere. But we have over 700 active agreements currently, and these agreements facilitate that cooperative research and development, as well as some material transfer agreements. So we leverage our unique skill sets and capabilities to support work at these other laboratories. I mean, it's a two-way street. We definitely can't do our mission alone.
So just on that note, does USAMRIID, and I know you mentioned another organization, First AMO, is it USAMRIID or AMO? Do you guys deploy scientists to the field if there's an outbreak in, let's say, Africa? Do you guys deploy there to investigate, or do you rely on who's already there to send you back and you guys do the lab work?
So the answer to that would actually be both.
Okay.
So, for example, the First AML, the First Area Medical Laboratory, some of those personnel actually work here within RID on a day-to-day basis, and then when the First AML deploys, they go with the unit. Some of our personnel serve as observer controllers for First AML exercises. I've actually got a couple folks who are currently out in the field with First AML. supporting it. But for the most part, USAMRIID personnel don't deploy on a day-to-day basis, but we certainly have sent folks out in the past. We were on the ground in Africa during the Ebola crisis, and we have folks that we regularly collaborate with, either by regularly visiting or corresponding with, or having them visit here on a regular basis. Now, some of that has slowed down with the COVID pandemic, but it's starting to pick back up again, and so. I mean, it's a little bit of both, whether we have direct reach back or whether we go out on field or whether we have folks here that regularly deploy with their main unit.
Gotcha. So I understand also that USAMRIID is a part of the Laboratory Response Network. What is that and how does USAMRIID support it, sir?
So the Laboratory Response Network falls under the leadership of the Centers for Disease Control and Prevention. And it's a set of early warning networks that detect the covert use of pathogenic agents. There's 4 different levels of labs based on their ability to support diagnostic needs, and some of them are at the state level and some of them are at the federal level. And USAMRIID is one of only 3 LRN, or Laboratory Response Network, national reference labs that are in the country. What that means is that we can do a complete diagnostic workup on an unknown biological agent.
Wow. So that's like a genetic sequencing to identify it and whatnot, I assume?
Yes.
Gotcha. So now I think we got to deal with the elephant in the room, and that's COVID-19. As you mentioned earlier, you guys got quite busy with that. So although your primary mission at USAMRIID is biodefense, just given the experience between the personnel and the organization with managing and responding to emerging disease outbreaks, I think it's important that we spend some time looking at how USAMRIID contributed to the COVID-19 response. So if you don't mind, sir, could you talk us through what you guys went through over the past 15 months or so dealing with COVID? Sure.
I mean, USAMRIID, I'm very proud of what USAMRIID's been able to accomplish over that time. We've played a key role in the nation's response to the COVID-19 pandemic, even while carrying out our core mission. And our support to Operation Warp Speed and the federal response encompasses a broad range of not only expertise but direct capabilities. Some of those capabilities include animal model development, diagnostic testing and evaluation of potential therapies, and biosurveillance. So, for example, COVID developed several animal models of SARS-CoV-2 infection that successfully replicates human disease. I'm very proud that one of the animal models is the first lethal disease model of COVID-19 in mice, as well as several non-human primate models. For example, our USAMRIID's Syrian hamster model was selected by Operation Warp Speed to rapidly identify therapeutics against SARS-CoV-2. In addition, USAMRIID was one of the first laboratories in the world to quickly develop and validate imaging techniques that visualize the novel coronavirus in animal tissues. And that allows us to create highly sensitive assays to assess the efficacy of countermeasures in those animal models. And so, I mean, what I just described, that body of work, is critical for testing vaccines, treatments, and diagnostic tests that will satisfy the Food and Drug Administration FDA requirements for licensing COVID-19 medical products, whether they're medicines or vaccines, et cetera.
Yeah, absolutely, sir.
So, I mean, in addition, we've sort of mentioned that LRN aspect, but USAMRIID serves as a 24/7 confirmatory lab for the entire Department of Defense, which means we provide diagnostic testing for mission-critical military personnel, and that in order to help leaders make informed decisions about force protection, return to duty. So we refined and tested multiple laboratory assays to identify COVID-19 samples, and we developed methods that determined whether individuals had protective antibody levels.
Now, sir, when you say assay, could you explain what that is for us, just for our listeners, in case they're unclear?
Sure. An assay is essentially a test.
Okay.
So, sometimes those tests are what we think of when you see maybe in the emergency room or urgent care center a card Sometimes it's a blood test. Sometimes it's a test that you have to send back to a laboratory. But it's, essentially various types of tests.
Okay.
So we actually worked with a sister lab called CCDC, or the Combat Capabilities Development Command, to assess one of those assays called a lateral flow assay, and that allowed us to identify suitable convalescent plasma donors in order to determine what their potential immune status was based on prior exposure to COVID. So that was critical in the development of that convalescent plasma.
Absolutely.
Additionally, we talked about therapeutics, and USAMRIID screened multiple drug compounds that were provided by collaborators using what we call our high-throughput screening capability. What that does is that allows us to quickly identify candidate drugs, typically, that will have activity against SARS-CoV-2, or the virus that causes COVID-19. So, we work with industry partners as well as sister labs to assess monoclonal antibodies as a potential treatment for COVID-19. In that process, we identified a candidate that showed great promise in the hamster model infection. And USAMRIID and CCDC, the lab command I previously mentioned, took part in a study that linked antibody levels in COVID-19 patients to their ability to control infection. And that provided, basically established potential benchmarks for the development of convalescent plasma as a treatment for COVID-19.
Wow. And so a lot of this work sounds like it's done with, I guess, the animal models. Is that kind of one of your fortes up there at USAMRIID?
It is one of our core competencies. Animal models are very important, especially in diseases that have high consequence, high infectivity, or no treatments against, that you test potential treatments in the animal models before going on to human use trials.
Now, I read a couple months ago about a potential vaccine, or a new vaccine that was developed by, I think, your sister lab. Could you give us any background on that, a COVID vaccine?
So the Walter Reed Army Institute of Research is another direct reporting unit to the U.S. Army Medical Research and Development Command, our higher headquarters.
Yes, sir.
And they're located down the street in Silver Spring, Maryland. And they've got a long history of excellence in investigating diseases like malaria and HIV, as well as a lot of other infectious diseases, and also traumatic brain injury, etc.
So did they focus more on, I guess, less lethal diseases, whereas you guys, because you're a biosafety level 4 lab, you could focus on the Ebolas and the high lethality diseases? Is that what I understand, or not?
Well, I would say that they concentrate on bacteria and viral illnesses that don't require study in biosafety level 3 or 4 necessarily.
Okay.
Or if they are studying the consequences of agents like that, they would coordinate with us to do some of the testing in our labs, but they might still be developing some of the other studies, some other portions of those diseases. But they, early on in the COVID-19 pandemic response, they certainly started to develop a vaccine against SARS-CoV-2. And they are currently in the midst of testing that vaccine candidate.
Is that in, I think, human trials now, correct, sir? Or
it's in early human trials, you are correct.
Gotcha.
And USAMRIID helped Rare with actually some of the NHP studies with their vaccine candidate.
Well, that's cool. So I gotta ask you, sir. Given that to me it seems like you guys have a really unique job in a unique environment, and I've seen a lot. What keeps you up at night? What pathogen or agent causes you personally concern? What's the scary guy out there? Well,
the scary guy out there is you could name probably any of the pathogens we've discussed, and if one of our adversaries were able to weaponize that agent and then had the intent to actually use it. But the other thing that I would say that would keep me up at night would be the next unknown. We don't know when the next organism is going to start causing disease in humans and potentially create the next pandemic. Mm-hmm. And so we have to be constantly on the alert for that next organism and its potential for causing widespread disease. Mm-hmm. And in fact, that sort of leads into sort of one last comment I would like to talk about a little bit is the biosurveillance approach that USAMRIID has developed with COVID-19 and maybe its ability to be applicable to other diseases.
Yes, sir. What's that look like?
One thing that USAMRIID has done is develop this biosurveillance approach that combines massive pooled testing with traditional assays and what's called next generation sequencing.
Now, is that testing of people or testing of animals?
This is testing of samples.
Samples,
so from animals or humans.
Okay.
What I'm talking about now is one for widespread testing for COVID-19 in humans.
Mm-hmm. Okay.
And what we do is it has the ability to take a significantly large number of samples and decrease the logistical burden, meaning some of the reagents that are in short supply as a result of needing to do testing all across the world. Mm-hmm. And it allows you to dramatically increase diagnostic capacity while alleviating that logistical burden. And so you literally can test tens of thousands of samples on a single run on a single instrument in a few hours.
Wow.
And get results.
So this is getting ahead of all the issues we had early on in the pandemic when we don't have enough tests, we're not doing enough testing. This is a kind of a solution to that.
That's absolutely correct.
Gotcha.
So what Dr. Kugelman and his team have done is have completed and successfully completed the proof of concept, and we're actually in the process of operationalizing that assay where we can translate results from the laboratory here at USAMRIID into procedures that can be used at military labs and civilian labs, for that matter, across the country and around the world. And so, another interesting thing that we can do with that is, besides dramatically increasing the number of samples, we can also look for multiple pathogens at the same time. Meaning, say you have a disease that might be the flu or COVID or even something else, you can actually put several different probes in this assay, and that allows you to take a single sample from someone, and not only is it COVID positive or negative, but if it's not COVID, if it's flu, you could potentially say that that it's the flu instead. So it has dramatic applications for many diseases, but certainly will dramatically increase the ability to maintain biosurveillance.
Wow. Well, sir, I was a little. I was hoping to hear something maybe about when I asked about what kept you up at night, like an individual pathogen that's lurking out there that's scary that we're not looking at. But obviously, it is the uncertain and the unknown. But I'm curious, when this past year with the pandemic and COVID-19 generally seems like a fairly mild agent. Some people experience no symptoms, some people experience severe illness. I was always afraid after watching the movie Outbreak, because I got to go back to that because that's my experience with USAMRIID is that film. I was always afraid of an Ebola type of outbreak. But we saw that in West Africa, and it was terrible, I'm sure, obviously, there. But it didn't reach the scale that COVID-19 did. Is that because some of these very lethal pathogens that are out there, they burn themselves out? And so we actually should be more scared of a flu-like agent?
Well, so, certain organisms become highly symptomatic rapidly, mm-hmm. and the individual may or may not be infectious to others before they're symptomatic. And so in the case of Ebola, for example, folks get sick pretty rapidly and they present to healthcare because they're in dire straits and need healthcare. And you can sort of curtail the spread of Ebola because the folks are self-contained essentially. Mm-hmm. In for example, COVID, folks can be infectious to others before they're symptomatic, or they can be infectious to others without ever becoming symptomatic. And that's what has allowed the rapid spread of COVID throughout the world and make it become a pandemic.
So does that indicate that COVID or the coronavirus, SARS-CoV-2, is that it's kind of a highly evolved virus because it's able to live within its host without presenting symptoms?
Well, I mean, viruses rapidly mutate, some faster than others, of course, over time, but viruses seek to exist and to continue to exist, and SARS-CoV-2 is no different. I mean, it's rapidly mutating. That's why you're hearing about some of the variants of concern right now.
Delta variant out of India, yeah.
So, certain variants will either make folks sicker or be more infectious or less infectious, et cetera. But keep in mind, for example, COVID has killed on an order of magnitude greater number of Americans than the flu does every year.
Mm-hmm.
So, even though there are some folks who have a relatively mild version of COVID-19, COVID-19 is killing, millions of people across the world, hundreds of thousands of people in the United States. So, I mean, it's not something to be trifled with.
Yes, sir. Oh, absolutely. Well, Colonel Cox, sir, thank you so much for taking the time to join us today. We really appreciate it. Is there anything else that I'm neglecting that we should cover?
No, I just, again, want to thank you and your listeners for taking the time to speak with some folks from USAMRIID today. We're very happy to share some of the things that we do and one of the roles that we've played in force health protection and multi-domain operations, and just hope that this information is useful for your listeners.
Oh, yes, sir. I think it's an absolutely, fascinating mission that you guys have, and a critical mission that, unfortunately, I think a lot of the Army may not be all that abreast of. So I think it's a great opportunity for us to talk, and I really appreciate it.
Well, thank you. I appreciate your time.
I'd also like to thank our listeners and note that the views and opinions expressed in this podcast do not necessarily reflect the official position of the United States Army, the United States Army Training and Doctrine Command, or USAMRIID. I'm Major Chris Parker, and this is Breaking Doctrine.